Is a snoring loved one keeping you up at night? If so, snoring does affect the 40% of the population here in the U.S., and sleep apnea, it affects about 40 million Americans. Here to explain options to treat snoring long-term is Dr. Barry Friedberg of Scottsdale Center for Dental Health. So good to see you.
Good to see you again.
What is sleep apnea? Because you were saying to me that this affects more people than smoking and losing weight.
Well, it's more harmful to the body than smoking or even being overweight. As amazing as that sounds, what happens with sleep apnea is the drop in oxygen over the night, as well as the inability to get into the deep stages of sleep or different stages, REM stage of sleep. There's certain stages where bodily functions are adjusted, hormones, rest, all sorts of stuff. And the drop in oxygen, the inability to get good rest, has more negative effects than smoking, overweight.
Yeah, we're seeing like a little graph here of how it all works together.
Well, what the graph represents is when you fall asleep, if you have sleep apnea, what happens is as your muscles relax when you sleep, your airway collapses. And you try to breathe. And you struggle, but the airway's closed. You're choking, or it's almost closed. You're sort of strangling, literally. The body goes into fight or flight. The sympathetic nervous system takes over, and you either stroke out, have a heart attack, or you wake up. It's called an arousal, and you may not even know you woke up. When you wake up, it takes you out of the stage of sleep you needed. You get your breath, hyperventilate, doze off again, and it recurs. And the sleep physicians measure how many times that happens per hour.
Yeah, some people say that they've, been in the bed and 25 seconds goes by before their loved one
25 seconds or a minute.
Wow.
And a lot of our patients have what we call witnessed apneas, where we ask the bed partners, have you ever seen them stop breathing?
Wow.
It's pretty scary.
Well, what is a CPAP? I mean, we've heard about that, and does it work on all patients?
Well, we have a CPAP on the table. That's the gold standard for the treatment for severe. And moderate and mild, the American Academy of Sleep Medicine says for mild and moderate cases, we can be a first line. It's up to the physician, not up to me as a dentist. But for severe cases, or those people who can't wear the CPAP, which unfortunately is a great number of people are intolerant, we try to take over with the oral appliance.
And the oral appliance is the other option that's available?
That's the other option we have. And the compliance is a bit higher, and we have some good results with it.
And we have a graphic of that as well. It's showing kind of the airwave and how it affects.
Yes. This is actually a patient of mine. We don't take these kind of images on everyone, but he's actually a physicist who developed that technology. And the pictures on the left show a view of his airway, which is that, long, narrow thing. People can probably figure that out. Without his appliance in his mouth, the picture on the right shows you how much larger his airway is with the oral appliance in his mouth.
Well, what is snoring a sign of?
Well, snoring is usually or often the first sign of a problem. The problem with snoring is that there are some studies that indicate additional plaque in the carotid arteries just from snoring. But what we have a problem with patients is if they say, I just snore, without a sleep physician in a sleep study, in the home or in a center, wherever, and we arrange all that. Without knowing they just snore, it can be very dangerous to treat snoring because you don't know if they're only a snorer or if they have sleep apnea.
And you'll do all of that?
And we quarterback all of that. Yes,
right.
That's the best way to put it, I would think.
Well, I love it. You go all over the world teaching about sleep apnea as a doctor.
A lot of fun. I'm going to Singapore in April to do it.
Well, thank you so much, Dr. Friedberg. And Scottsdale Center for Dental Health is offering you a free consultation if you feel you could be affected by this. To all Sonora Living Live viewers, they're located at 9787 North 91st Street, Suite 102. That is on the southeast corner of 91st Street and Mountain View in Scottsdale. To make an appointment, call 480-718-9775.